Hello dear students, welcome back to the Pharma Learning channel. Today I came with the part 2 of the video that will highlight the various types of the mathematical problems or the calculations related to the pharmacy. This part 2 of the video is also useful to the pharmacy students for their study or for their syllabus or the curriculum as well as they want to appear for the license exam. So let's go into the details for this part 2 video. Before I start, if you need for any tutoring the coaching need for any of the license exam preparation or any of the subject or any of the topic related to pharmacy, you can feel free to contact me on the pharmalearning@gmail.com. Before I start with the part 2 of this calculations, please refer or please watch my part 1 video that is related to the calculations that is going to be useful to you. Now, this is part 2 video into which I will highlighted mainly two types of calculations. Because when you are going to work into the pharmacy or the clinical side, when you are going to come into the contact with the patients here the two things you require. The first one is that you have to calculate a dose on the basis of patient age, body weight and the body surface area. Generally, the patient's age, body weight and the body surface area are going to be vary. So depending upon that, as a pharmacy technician or as a pharmacist, it is your responsibility to give the exact amount of the dose to a particular patient. Whether it is going to be prescribed carefully by the physician or the prescriber in the prescription or the not. If it is prescribed, it is written, yes, it is a duty of the pharmacy technician or the pharmacist to cross-check that one. The second type of calculation that I included into this video that is related to parental preferences. As you are knowing that the word parental stands for the par means besides, enteral means intestinal route. So this parental preferences like intravenous infusion that is going to be required to be given to the persons who are present in the hospital. So this is very useful. This calculations is very useful for the pharmacy technician or the pharmacist who are working within the hospital and they are dealing with the indoor patients into which they will have to find out the infusion time. What should be the flow rate of this intravenous infusion and the unit like drops per minute, or what should be the flow rate in the ml per hour which is based on the dose requirement. So now let's go into the details for this one. The first highlight how do you got the calculation of the dose on the basis of the patient age. Generally, this formula is going to be used into the small child. So that's why I written over here the child dose. The child dose is equal to age in the year divided by age in the year plus 12 multiplied with the adult dose. Now, the most important thing is that we are converting the age of the child into the year. And how we can do that one? As we simply know that the 1 year is equal to 12 months is equal to 365 days. So whatever the age of the child is given, let's say it is given like 6 months. Okay, so it is given like as for example, calculated dose for a child, okay, having the age of 6 months. So naturally the age is going to be in this case convert into the year, so it will be the zero point 0.5 year. So into this formula I will put 0.5 over here 0.5. Keep in mind you will have to convert the age from the days or months or the weeks to the year and then keep in the formula to get the exact dose. Number 2, that is on the basis of the patient's body weight. So here again the patient's body weight when you are going to convert, that's a child dose equal to the weight in the pounds divided by 150 multiplied with the adult dose. Yes, here important thing is we'll have to keep the weight in the pounds, and how you convert the weight from the kilo. If it is given directly in the pounds, yes, you can keep it and find out the child dose. But if it is given in the terms of kilogram, then please convert into the pound by multiplying with the 2.2 because the 1 kilogram is equal to 2.2 pounds. Next, third type of calculation, that is based on the body surface area. Here the most important thing is that here the child dose is equal to child body surface area, that is meter square, divided by 1.73 meters square multiplied with the adult dose. The important thing is over here where you want to find out the body surface of the child, then you require the weight and the height. So I keep the weight and the height. Okay, so weight multiply with the height and divide by 3600, and I will take the square root of this one. Okay, it's not on the slide, but I will take the square root, and that square root, whatever the base, the body surface of the child, I will keep it over here. So that will come in the meter square. Okay, I will keep it over here, and then I will find out the child dose. So by the previous, either by the age or by that, or by the weight or by the body surface area, yes, you can find out the exact child dose. Now let's go to the second part of this video, that is a parenteral preparation intravenous infusion. To calculate the infusion time, it's very important. So what I will do, I will find out what is the volume of infusion and divide by the flow rate, that is the ml per hour or ml per minute, and I will find the infusion time. Let's take one example. If a person is to be infused or it is to be administered with the 500 ml of the Singer's lactate or the simple sodium chloride solution, okay, and it is to be completed within the 2 hours, so that is 500 ml divided by the flow rate, that is to be completed in the 2 hours. Okay, so here the flow rate, at what rate I will give, that is I will generally give it the rate of 250 ml per hour, so I will complete the infusion time within the 2 hours. The second, to calculate the flow rate by using this formula. This is very important when I will to exactly calculate the flow rate in the terms of how many drops are coming out from that IV cannula per minute. So it is like it is equal to volume of the infusion in the ml multiply with the drip set, that is drops per ml, divided by the time in minutes. So that's very important thing will be there. So as for example, a medication, let's add on this. A medication order calls for 1000 ml of the D5W, that's a dextrose 5% in water, to be administered over a period of 8 hours. Now during the administration, that the SAT delivers at the 10 drops per minute. So how many drops per minute should be delivered to the patient? See, so my target is 1000 ml of the fluid D5W. I will have to administer within the 8 hours. So what I will do, I will divide 1000 divided by 480. So I will have to administer 2.08 ml per minute. So approximately 2.1. Okay. So now for that 2.08 ml per minute, and my drop set will deliver at the 10 drops. So I multiply with the 10. So 20.8. So exactly when I am setting that IV infusion, IV cannula set, I will have to check repeatedly that exactly 21 drops are coming per minute. If I am following this one, then I can, yes, I can set up the desired infusion rate. The third one, to calculate the flow rate in the ml per hour when based on the dose. So I can say that the infusion rate is milliliter per hour is equal to the patient weight multiply with the dose, that is the m microgram or milligram or units per kilogram, what is the units will be there, and that's I'm going to multiply with the 60 and divided by the drug concentration. This looks somewhat complicated. Let's try to understand this formula simply by this numerical. A drug 2.5 milligram per kilogram is prescribed for a neonate, that's a newly born baby having the weight of 1.5 kg. Then calculate the dose of the drug, and the number 2, when the drug is placed in the 50 ml of IV bag, the flow rate in the ml per minute if the infusion is to be run for 30 minutes. So let's try to solve first one, the dose of the drug. Here the 2.5 milligram of kilogram, that is indicating the dose. It means that for the 1 kilogram we require 2.5 milligram. So here the neonate is having the weight of 1.5 kg. So naturally it required 2.5 times 1.5, so it is equal to 3.75 milligram. Number 2, when the drug is placed in the 50 ml of IV bag, and I have to run for the 30 ml. So it's very simple, 50 ml for 30 minutes. So I will divide the 50 ml divide by 30 minutes. So I'll have to give patient 1.67, so that is equal to 1.7 ml per minute. So if you are following this particular formula, I will be able to administer the patient with the required volume of the infusion, and that will help you the maintenance of the required drug concentration within the body for that particular patient. So if you like my video, please give like to my video, share to your friends, and please subscribe to my Pharma Learning channel for the more upcoming videos on the various topics related to the pharmacy. Thank you.